The free medical brace lie. How a $0 Medicare perk triggers a $40,000 identity drain. A free Medicare brace sounds harmless, right? Say yes once, and you can trigger years of denied care and padded billing you never see coming. The top 1% who catch this early don't fall for the brace. They spot the identity drain. Here's the lie. Dollar back brace, no copay. Here's the trap. Your Medicare number gets used like a credit card, and the charges stack while your future claims get blocked. One quick okay can snowball into $40,000 in fake claims and real denials. This isn't rare noise. Medicare fraud is estimated around $60 billion a year, and your number fuels it. In the next few minutes, I'll show you exactly how the scam works, how to undo the damage fast, and the return to sender move that stops charges cold. This isn't about a brace. It's about protecting your Medicare identity. The hidden cost of free. Let's start with the why, because the cost of free isn't the price tag. It's what it burns. The first hit is emotional. It's embarrassing to tell your doctor you said yes to a call. It's scary to see bills with suppliers you've never heard of, and it's frustrating when you try to fix it and feel like nobody's listening. That fear keeps people quiet, and silence is exactly what mills rely on to keep billing. The second hit is opportunity cost. Durable medical equipment has replacement windows. If a back, knee, or ankle brace shows up in your history, your next real device can be denied under same or similar rules for months or years. When you actually need care, the system thinks you already got it. Here's the belief break. It's free, so it can't hurt. Wrong. It burns your benefit history. Your Medicare number works like a medical credit card. When you share it, suppliers can submit claims to Medicare under your identity. Scammers know this, so they dangle no copay to lower your guard and harvest your number, your address, your doctor's name, and keywords like chronic pain. That's enough to push paperwork that looks legitimate to claim processors. Now, the good news, the sentinel effect. When beneficiaries and caregivers actively read their Medicare summary notices, make unknown supplier lists, and call Senior Medicare Patrol, fraud drops. Visible oversight shortens billing runs. Scammers move on when they see you're watching. I've seen this play out. The moment someone starts logging calls, saving labels, and reporting fast, the bogus claims stop appearing and older ones get reversed sooner. This is a behavior signal. Consistent audits, refusals, and reports trigger reviews and repayment demands. So mills abandon vigilant targets. Social proof matters. Senior Medicare Patrol programs report tens of millions in combined savings and recoveries each year. Recent program data shows more than $35 million in recoveries and cost avoidance in a single year. That's traction, not the total scale, but it proves that timely reports move dollars back and shut down repeat runs. Why does this work on so many smart people? Because it echoes a real event. In 2018 to 2019, Medicare did replace cards to remove Social Security numbers. Scammers still mimic that change with the plastic card with a security chip pitch. It feels modern and safe, so verification questions don't raise alarms. Once they get your number, they funnel it to a telehealth mill, then to a DME supplier. And the billing spree starts. If you remember nothing else, remember this. Guard your Medicare number, read your MSNs like a bank statement, and act quickly. Small steps today prevent denials tomorrow. Now, let me show you the exact lie they use to get your number. The new card lie that opens the door. Here's the exact script they're using right now. The phone rings. Hi, this is Medicare Outreach. We're issuing a new plastic card with a security chip to protect your benefits. It's free and pre-approved. I just need to verify your Medicare number, your address, and your primary care doctor so we can ship it. There's no copay, and this is a limited time wellness upgrade. Can you confirm those details for me? That's it. Short, friendly, and designed to sound like a courtesy call. Why does it work? It echoes a real memory. In 2018 and 2019, Medicare replaced cards to remove Social Security numbers. So new card feels familiar. Add the word chip, and it sounds safer, like your bank card, even though Medicare does not issue chip cards. Toss in no copay and pre-approved, and your guard drops. You're not giving information, you're confirming. What are they actually collecting? For things that matter: your Medicare number, your address, your doctor's name, and any pain or condition keywords you casually mention, like sciatica, knee pain, or neuropathy. Those keywords become diagnosis bait. They'll attach them to boilerplate visit notes later. Now, the hidden funnel kicks in. The caller passes your info to a telehealth mill. You might get a quick follow-up call. A licensed provider will review your wellness upgrade in a brief televisit. This ensures your card and benefits stay active. The visit is a 30-second checkbox script. Rate your back pain 1 to 10. Does it affect daily activities? They capture a diagnosis code and a minimal face-to-face note. On paper, that's enough to claim medical necessity. From there, your data flows to a DME supplier, often one you've never heard of, in a different state. They pick a device that matches the diagnosis and is easy to ship: a back brace, knee brace, ankle-foot orthosis, or wrist splint. Then they bill Medicare under a DME HCPCS E-code. If they think they can bill more, they'll add topical creams, orthotics, or even toss your info to a lab for screening panels. No one asks you again. The chip card story was the single consent moment they needed to extract your details and fabricate medical necessity. Here's the twist that most people miss. The scammer doesn't need you to use the device. They need a shipment record. Once a label prints and a box moves, billing starts. Even worse, the moment that first claim hits, it can block future legitimate claims under same or similar rules for months or years. That's the denial that shows up later when you actually need care. Let me show you the telltale phrases so you can hang up fast. New plastic Medicare card with a chip. Pre-approved wellness upgrade. No copay. We just need to verify your Medicare number to mail it. Limited time replacement to keep benefits active. Your counterscript is simple. I don't confirm Medicare information by phone. Mail me official notices. Then hang up. If they persist, repeat it. Every extra second you stay on the line, they're probing for crumbs, doctor names, conditions, anything to legitimize a claim later. The reason this works is paperwork, not medicine. On paper, it looks adequate. In real life, it's a data grab that opens the billing door. Next, you'll meet Arthur, and you'll see how one okay turned into a denial when he actually needed a brace. Arthur's denial trap: intention, obstacle, stakes, resolution. Arthur's a straight shooter, 72, retired machinist, still mowing his lawn and doing light yard work. 2 summers ago, he got that new plastic Medicare card with a chip call, then a second call offering a $1 back brace. He wasn't trying to game the system. He thought it might help when his back flared after raking. He said, okay, a box arrived. He never wore the brace. It sat in the hall closet. Fast forward 22 months. He slips on a wet step, bangs his knee, and now he actually needs a medically fitted knee brace so he can do PT and walk without pain. His orthopedist writes the order. It should be simple. Instead, the claim pings back denied. The code line reads like alphabet soup, but the pharmacist circles it for him. Same or similar. On the remittance, it translates to reason code 97 with Remark code N390. Here's what that means in plain English. The system thinks Arthur already got a similar device within the replacement window. For many DME items, Medicare's same or similar rule locks you out for 13 to 36 months, sometimes longer depending on the HCPCS E-codes and useful lifetime rules. On paper, Arthur has a brace on file, so the new brace is included in a prior allowance. No payment, no device. Pain continues. Arthur does what most people do first. He calls the supplier listed on the denial. They've never heard of his orthopedist. They read a different supplier name back to him in another state. He pulls his Medicare summary notices out of a shoebox. Now it gets weird. He sees multiple suppliers he doesn't recognize and charges tied to dates he never received anything. The closet brace, that one lines up, but there are refills and even a wrist splint he never ordered. This is the moment that clicks. The denial isn't about his knee today. It's about identity use yesterday. That chip card call and the quick televisit created a paper trail, a checkbox pain scale, a diagnosis code, and shipment records. It looks legitimate to a claims editor. That's why the system said no. Now, here's how he turned it around. First, he audited 3 lines on every MSN, who billed what item code, and the date shipped/dispensed. He starred anything outside his state or doctor network. He photographed the old brace label from the closet and wrote, "Unsolicited DME, refused use" on a note, then signed and dated it as a statement. Second, he opened a case with Senior Medicare Patrol and called 1-800 Medicare to request a fraud tag and claim hold on the suspicious suppliers. He gave dates, suppliers, and those HCPCS E-codes he could read from the MSNs. Now, there's a paper trail in his favor. Third, he called his orthopedist's office and asked for a letter that stated medical necessity for the knee brace and confirmed there'd been no prior knee device issued or used. He attached that to a Level 1 Redetermination request with his DME MAC within the 120-day window. He included his sworn statement, SMP case number, and screenshots of the suspect MSNs. He also asked the hospital DME for a temporary loaner brace while the appeal processed. Here's the part most people miss. Arthur also demanded the face-to-face visit notes from the unknown supplier's doctor. The Mills notes were generic, a 30-second checkbox, no exam findings. That weakness helped the reviewer see the pattern. Finally, he used a simple call script with every contact. "I did not consent to these items, I did not receive or use them, and I'm requesting removal from my record and reversal of charges." Calm, repeatable, written down next to the phone. Payoff. The denial reopened. The knee brace got approved with a temporary authorization, and several bogus DME lines were reversed. More important, the Mills stopped. Once Arthur started logging, reporting, and pushing for notes, the billing run died out. The closet brace became evidence instead of a roadblock, and he walked back into PT, wearing a brace that actually fit. The $40,000 math. How small items snowball. Let's unpack the math that turned Arthur's okay into years of trouble, because this is where small items quietly add up to real dollars and real denials. It usually starts with a modest claim, like a $500 back brace. On its own, that's annoying, not devastating, but Mills rarely stop at one. Once your Medicare number is active, they layer phantom items that fit the same narrative: diabetic test strips you never use, topical pain creams, orthotics, wrist splints, even genetic screening panels. Each line looks reasonable in isolation. Together, they turn your record into a supply closet you never ordered. Now here's where the gear shift happens. Recurring cycles. A lot of DME and supply codes are billable on a refill schedule. That means monthly, quarterly, or as-needed shipments get pushed through without anyone checking your doorstep. No box arrives, but refills show up on your Medicare summary notice. If you're not reading your MSNs, those repeats stack fast. The second multiplier is trial build equipment. Scooters and other mobility items sometimes appear as short-term rentals that were evaluated or trialed. In many cases, there's no real evaluation, just a checkbox. The claim hits anyway. Even small monthly rental amounts can creep along for months before anyone blinks. Here's the rule that locks in the damage. Same or similar. Most bracing and orthotics fall under MIPOs, E-codes, and many have replacement windows that run from 13 to 36 months, with typical reasonable useful lifetimes often spanning 3 to 5 years under Medicare policy. Once any E-code posts in your file, a different supplier can argue your next brace is included or already provided. That's how a $500 fake back brace can block a legitimate $900 knee brace 20 months later. The money is one problem. The denial of needed care is worse. Add in lab plays, and you see the snowball. Genetic testing panels often bill as bundled G codes. A single panel might run hundreds to over $1,000. If a mill links 2 or 3 panels across a year using the same televisit notes, you've now stacked thousands without a single office visit. Oxygen scams are another high-dollar lane. We'll flag more in the audit section, but rentals like E0424, stationary gaseous oxygen system rental, and E0439, portable liquid oxygen system rental, can appear as long-running monthly charges. If you never used oxygen, that's pure burn. If you did, overlapping rentals from different suppliers blow up costs even faster. Capped rental rules spread payments over months, which can mask abuse during a quick review. So, how does this hit $40,000? Think in episodes. Episode 1, $500 brace, $1,200 in creams, $900 in orthotics, $2,400 in refills, and a $1,200 genetic panel. Now you're near $6,200. Episode 2, a year later, repeats the brace lane with knee and wrist items plus more labs, another $7,000 to $10,000. Episode 3 adds a scooter, trial, and oxygen rentals that run for months. There's another $8,000 to $12,000. Across a few years and a couple of mills sharing your number, crossing $40,000 isn't rare. It's routine. The toughest part is the timing. Every bogus claim also resets replacement clocks and triggers future denials. You pay twice. Once in dollars, Medicare shells out. Again, when your real care gets blocked under same or similar. The fix is speed and documentation. Catch refills in month 1, not month 12. Refuse boxes the day they arrive. Push for redeterminations before replacement windows expire. Every week you save cuts charges and shortens denial windows. And that's how you stop the snowball before it buries you.